But I got his results. You didn't see it?
Then he had to call everybody back and tell them.
You guys mute those people. Okay, we're live, Senator Kelly.
Okay, so we ready?
We're ready.
Good afternoon, everybody. The Senate Finance Committee is now in session. Today we have several very interesting bills to hear. I'm going to just read the bill numbers and titles so that you get an idea of the order. Senate Bill 53, Clean Energy Attribute Credits, credits and procurement.
We're taking, Senator Kelly, we're taking them in this order.
Okay, all right, okay, all right. Okay, we're a little bit out of order. Let me go back. Senate Bill 164 is going to be first. And then Senate Bill 163. Senate Bill 168. Senate Bill 96. Senate Bill 219. Senate Bill 235. Senate Bill 256. Senate Bill 279. Senate Bill 83. And finally, Senate Bill 53. Order for today. Okay, and so at this time, we're going to start with Senate Bill 164, Senator Simon-Ayer. Veterans, Behavioral Health Services, Mental Health First Aid. And we have 4 people signed up with oral testimony, including the sponsor. And so we'll get started now with Senator Simon-Ayer.
Thank you, Madam Chair. I'm assuming you can hear me?
Yes.
Great. Well, I'm excited to discuss this important topic of veterans' mental health. Given the impact of COVID on mental health, this is even more timely issue. Last year, this committee passed this bill unanimously on the same day of the hearing, with each member co-sponsoring it. But due to COVID, we ran out of time on the House side. It has a wide range of support with over 15 veterans groups, the Veterans Caucus, MedChi, Mental Health Association of Maryland, and many more. So I'll just give you a brief overview since we had this last year, but there's 2 main aspects. The first is it requires the department to include the mental health first aid training in their service coordination within the constraints of the budget. And it consists of training for veterans and immediate family members. And it focuses on how to identify and respond to the signs of mental illness and substance abuse. And the second thing is a reporting requirement that shows how many veterans and their immediate family are being trained service providers. We hope to get a better handle on how many are actually being trained. And as we saw last year, access and preventative measures are key. And the goal to preventive health and having more veterans in their family is having access to this training. We also saw that the mental health first aid training is robust and mature. It came from Australia back in 2000, and it teaches the public how to help persons with mental health issues. It does not teach people to treat or diagnose mental health, but how to offer initial support until professionals are available or the crisis is resolved. And by 2016, the program had spread across the world and 1.7 million people had been trained. Our Department of Health, the Mental Health Association of Maryland, which you'll hear from later, and others were involved in an effort to adapt the course for America. In Maryland, as mentioned, thousands have been trained, but limited number of veterans have been trained, and this bill aims to change that. The Mental Health Association of Maryland went a step further and adapted the program to focus on veterans and their immediate family. While annually thousands of other segments of our population receive this helpful training, only 40 veterans a year were trained over the last 6 years. Or stating that differently, 250 veterans in the last 6 years were trained. When Maryland is home to over 370,000 veterans, and when you count in the immediate family, that total goes over 1 million. So 250 people out of 1 million. The sad reality is that far too often, veterans are committing suicide in our state and dealing with unique issues related to previous service in the military. It should be noted, while the Department of Health is working extremely hard and providing needed resources, our veterans are committing suicide at alarming rates, even under existing policies. We want to do everything possible today to incorporate improvements in our process that bolster existing policy. This legislation is not the solution to every problem veterans and their families are dealing with, but it is a good step in the right direction and another tool in the toolbox. Given the protocols this year, I was unable to offer co-sponsors on my pre-filed bills, but I welcome your co-sponsor again this year and ask for your favorable consideration. Thank you.
Thank you. We'll move next to Brian Smith, and then we'll hear from Dan Martin of the Mental Health Association, and finally from Patrick Gubayo from the Maryland Military Coalition. Okay.
Well, good afternoon, Chair Kelly, Vice Chair Feldman, and members of the Senate Finance Committee. My name is Brian Smith. I'm a post 9/11 combat veteran. I have PTSD. I've lost friends to suicide, and I'm here today to offer my support for Senate Bill 164. Last year, when a veteran friend of mine took his life, he left friends, family, and 2 unanswered questions asked by many of us that knew him. How could I have known, and what could I have done? Thus, the challenge and the solution are rooted in knowledge and empowerment. As you know, this legislation implements a mental health first aid program for veterans and their families. This training program will enable veterans and their immediate family members to identify and respond to signs of mental illness and substance abuse disorders. Why is this so important? Well, 2.7 million service members have been to the war zones of Iraq and Afghanistan since 2001. Over half of them have deployed more than once. In fact, over 400,000 have completed 3 or more deployments. At least 970,000 of these veterans, over 1/3, have some degree of a service-connected disability as a result of war. About 18% of service members returning from Iraq and Afghanistan have post-traumatic stress disorder. That's nearly 500,000 veterans. And as we know all too well, 20 veterans or more die each day by suicide. Many times that number of Americans have borne the costs of war as spouses, parents, children, and friends that cope with their loved one's absence, mourn their deaths, or greet the changed person who often returns. Many Iraq and Afghanistan veterans face a life of disability due to the physical and psychological injuries they sustain in the war zones. Many more live with emotional and physical scars despite lack of a disability status. Sadly, due to the stigma, many veterans with mental health problems do not seek help, or they delay seeking help. Even when people decide to get help, it's frequently after many years of delay. The longer a person waits to seek help, the more difficult their recovery can be. And all too often, our veterans take their own lives. Mental health first aid provides effective awareness and action-oriented training that can help address this mental health crisis, and it is widely applicable beyond the veteran community. So as for those 2 questions I had to ask myself last year, how could I have known? Well, this training helps provide the knowledge of potential mental health warning signs. The other question, what could I have done? This training provides actionable recommendations on effectively connecting veterans with the appropriate professional caregivers. Now that we know about this first aid training, what can we do here today? Please move this important legislation forward. I respectfully request a favorable report for Senate Bill 164. Thank you.
Thank you very much. Very impressive testimony. We'll go now to Dan Martin.
Madam Chair, members of the committee, Dan Martin with the Mental Health Association of Maryland. It's great to see you all. This is my first time testifying before finance this year. So again, really great to see you all, and hope everyone's doing well, and look forward to seeing you many more times this session. I'll be quick because, like Senator Simoneau said, this bill passed unanimously through the Senate last session before it was, fell victim to the truncated session and didn't have time to get through the House. So I, urge your support again for it this year. And thank you, Senator Simoneau, for introducing it again. The bill requires the Department of Health to include mental health first aid training among the behavioral health services that it coordinates for veterans and their families. It doesn't require any additional funding. The fiscal note implies that the bill codifies current practice. I think that's probably technically true, but what it really does is encourage the Department of Health to direct mental health first aid more proactively to more veterans and their families where we know it's one of the places where it's needed most. For those, I know we have some new membership on the committee, so it's kind of give a little bit of background for folks that may not know. The program is a world-renowned evidence-based program that teaches how to recognize and respond to a person with a mental health concern or crisis. The core course includes information about various behavioral health disorders, risk factors about warning signs and mental health concerns, and a 5-step action plan that helps someone in crisis. And there's also a veterans module that includes a discussion of military culture and mental health, specific risk factors faced by service members and their families, and community resource information, and a lot more. And so as was noted by Senator Simoneau, Mental Health Association has played a central role in adapting mental health first aid for the United States. Since 2009, we've been the organization that has facilitated the statewide mental health first aid program. And in that time, we've trained over 36,000 Marylanders, including 700 instructors. And you can see in our written testimony, we have a 10-year impact report that'll kind of give you all the history of what we've been able to do. We do that through a core of instructors and master trainers who primarily deliver free and scholarship-based trainings through a state grant so that we can ensure that no one seeking mental health first aid is turned away. And so we are mission driven to get this training out to as many folks as possible. So to the extent this bill will help us direct the program to more veterans and their families, we're all for it. And I would urge a favorable report.
Thank you very much. I will go next to Patrick Yerbell. He's not here. Okay, he's not here. Let me say this, colleagues. We've got a lot of very impressive written testimony also, and because we're in this virtual environment, we find the time to hear it all, but you want to hear from the Maryland Catholic Conference, from SWATS, METS, and WISE, from the AARP. Everybody is supporting, and there is no unfavorable at all. So we want to remind you of that. You want to take a look at it because it really is important. Remember that the sponsor just invited us all to sign on if we'd like to be co-sponsors. So when we vote, we'll consider that. Are there any questions? All right, if not, very good. We're going next to Senate Bill 163. And that's Senator Ellis. Here.
Thank you, Madam Chair Kelly,
Thank you.
Vice Chair Feldman, and members of the Finance Committee. I'm Arthur Ellis, representing Charles County, District 28, here in the Senate of Maryland. And I'm here before you this afternoon to present Senate Bill 163, Maryland Medical Assistance Program, in reference to doulas. This bill would require Medicaid to provide certified doula services, including childbirth education and support services, and emotional and physical support during pregnancy, labor, birth, and postpartum. Research indicates that support from a doula is associated with lower cesarean births, fewer obstetrical interventions, fewer complications, decreased use of pain medication, shorter labors, and higher scores for newborns on the APGAR test. And APGAR stands for appearance, pulse, grimace, activity, and respiration. That's the APGAR test. Let me repeat again. Folks who use doula services. They have lower cesarean rates, fewer obstetrical interventions, fewer complications, decreased use of pain medication, shorter labors, and higher scores for their babies. I just want to make sure that when we look at the disparities affecting so many poor women and women of color and Black African-American women, we see that the numbers are out of control when it comes to maternal death outcomes, death of the mom, the child during pregnancy. In addition, I met with some certified midwives last night, and they told me a number that is very scary. In Maryland, the C-section, cesarean section for women of color is 35%. That means 35% of ladies giving birth in Maryland are given a C-section. The World Health Organization, number for that, where the maximum should be in the community, should be, 10 to 15%. So WHO, the World Health Organization, say a 10 to 15% cesarean rate is the maximum that a community should have. In Maryland, rich Maryland, one of the richest countries in the world, the C-section rate is 35%. And so when we expand the use of doulas in Maryland, that rate will come down, the C-section, cesarean section, and the rate and the vitality of babies born in Maryland will increase. I must say, we need Medicare to cover this, Medicaid to cover this for those on Medicaid, because doula services are kind of expensive. Hiring doulas will cost between $700 and $1,500 per session. And the most recent data from 2013 shows that only 6% of women who gave birth employed a doula, 6%. Further, this cost barrier has disproportionately affected women who are already at high risk for poor birth outcomes. A 2014 study found that Black and low-income women were twice as likely as white, privately insured women to report wanting but not having doula care. So I just want to read a recommendation from this past President's Work Group on Equity and Inclusion. And this recommendation was in the report from the President's Committee on Equity and Inclusion shared by President Pro Tem Melanie Griffith. Recommendation number 9 in that report states that we should establish a Medicaid doula pilot program in 2 counties that require Medicaid to cover some doula services, ensure that participating doulas are enrolled as Medicaid providers, monitor doulas and mothers for the duration of the pilot, and analyze relevant metrics, determine if the state should scale the program further. In addition, we should authorize Maryland Department of Health to determine the county or counties in which the pilot program will launch based on available county level data. I must say, unfortunately, Maryland will not be the first in bringing doulas into the Medicaid system. States including Minnesota, New Jersey, New York, and Oregon have piloted or launched programs providing Medicaid coverage of doula services. Specifically, the New York State Doula Pilot Program provides a strong model for Maryland. New York launched that program in 2019 in 2 counties, Erie and Kings County, 2 counties with some of the highest maternal and infant mortality rates. Erie County is upstate New York. Kings County, we otherwise know that place is Brooklyn. So New York launched 2 counties to be the pilot for the doula program. The program reimburses participating doulas for up to 4 prenatal visits, support during labor and delivery, and up to 4 postpartum sessions and visits. The program effectiveness is determined through monitoring breastfeeding rates and adherence to postpartum visits, and administering surveys to participating doulas and mothers. I must say, this is a modest program for us to really take a solid step to try to end the disparities in outcomes when it comes to childbirth. I just want to open up for any questions and urge my colleagues a favorable report on Senate Bill 163, the Maryland Medical Assistance Program for doulas.
Thank you very much. Okay, we're going next to Laura Bogley, Maryland Right to Life.
Good afternoon, Madam Chair, and thank you. Thank you, Senators, for your time today. My name is Laura Bogley, and I'm the Legislative Director for Maryland Right to Life. On behalf of our members in Charles County and across the state, I strongly oppose Senate Bill 163 as written because it deceptively speaks to pregnancy without disclosing that it can be used to create an alternative funding stream for abortion coaches. The abortion industry is attempting to appropriate the term doula and to rebrand themselves as providing full spectrum doula services to include abortion. But this is misadvertising. Abortion coaches are not doulas. Doulas are an important part of a long-standing, life-giving and life-affirming tradition to welcome a child into the world, not into the wastebasket. They are trained to give physical and emotional support in childbirth. They are skilled in comfort and relaxation techniques for labor, including position changes, breathing exercises, and massage. I think Senator Ellis expressed very well the importance of traditional doula services to healthy mothers and babies. But by approving this bill, the state would be diverting critical funding away from birthing coaches and childbirth services and forcing taxpayers to again subsidize the billion-dollar abortion industry. If Maryland is serious about reducing maternal mortality rates, particularly among women of color, we must prioritize funding for health and family planning services, which have the objective of saving the lives of both mothers and children, including programs for improving maternal health and birth and delivery outcomes. We know that abortion increases the rate of complications in subsequent pregnancy. We respectfully urge you to reserve public funds for legitimate dualing services and amend this bill to exclude abortion-related services. Otherwise, we ask for your unfavorable report. Thank you again for your time today.
Doing about questions. Okay, are there any questions? Well, maybe I'll just ask one of the last witness. I looked at the bill. I see nothing in the bill that suggests that it does anything regarding abortion. So what about it? Where in the bill do you see whatever you're referring to that you have concerns regarding?
Well, thank you for your question, Madam Chairwoman. In Maryland, we do not have a Hyde-style amendment to restrict abortion funding. So the only way to make sure that any pregnancy-related services don't serve as an umbrella in implementation of the law for abortion services or termination of pregnancy as an option under the pregnancy umbrella is to specifically exclude that language in each bill. This bill was supported last year by the Baltimore Doula Project, which primarily provides abortion coaching services. We expressed our concerns to Senator Ellis last year about the errors in this bill. We would ask the committee to consider and the sponsor to consider an amendment to specifically exclude its application and that a diversion of funds to the abortion industry and preserve them for these life-giving doula services, which are very important. We agree with the senator in that regard.
Okay. Well, I wish it could have been more specific because I just don't see anything in the bill and found nothing in the sponsor's testimony that would suggest that the conclusion you're reaching is based on anything we can put our hands on. So if you find that there's more information that you could share to show that funds intended for one purpose would be automatically going for some other purpose, we'd appreciate getting, that written information. Are there any other questions? Okay, if not, then that ends the testimony on Senate Bill 163.
Thank you.
All right, we're going next to Senate Bill 168, Senator Eckhart. And, okay, she is here.
Thank you. Yes, thank you very much, Madam Chair and members of the Senate Finance Committee. I appreciate the opportunity to present this bill to you. I think we presented it last year. It is Public Health Maryland Suicide Fatality Review Committee, and it's a response to the mental health and continued suicide crisis in our state and throughout our nation, both of which have been exacerbated, as you know, by the pandemic that we're experiencing. We know that suicide is a serious problem in our state. And in 2009, the Governor's Commission on Suicide Prevention was established. The commission's preamble identifies suicide as the 11th leading cause of death in Maryland. Senate Bill then is an extension of the commission's efforts to provide early intervention and try to prevent suicide deaths. It establishes a suicide fatality review committee that will examine factors contributing to those suicide deaths. It would study trends, risk factors, best practices, lapses in response, and barriers to safety. The team will meet quarterly and make recommendations on policy or law changes to both the governor and the General Assembly. And the studies and findings will be disseminated to our policy makers, healthcare providers, healthcare facilities, and the public. As we continue through this pandemic, it's important that we address the impacts to those most at risk, including those with serious mental illnesses and other continued stressors. This bill is an essential step in suicide prevention, as the data and information are necessary to craft preventative measures. Thank you for your consideration, and I respectfully urge a favorable report. We currently have our opioid death review teams, and I know members of the commission have worked very closely with the medical examiners, and we find that in a lot of the medical examiner cases, if you don't clearly meet the criteria for a suicide, it's kind of in a separate category. We think that there are other factors that may be found, as have occurred in other states with suicide review teams, that would give us more insight into providing some alternate measures that ultimately might delay and interrupt suicide attempts. So thank you for your consideration. And we have several witnesses, I think, who will explain in more detail the necessity of this measure.
Thank you very much. Are there any questions of the sponsor? Okay, we're going then to Paul Nastek for oral testimony.
Hi, my name is Paul
You
Nastek.
get
I'm a
5
psychiatrist.
minutes.
Thank you, Chairman. I'm a psychiatrist and I'm an epidemiologist at Johns Hopkins. I'm a member of the executive board of the Maryland Psychiatric Society and a consultant for the Governor's Suicide Prevention Task Force here in Maryland. Recently, a freshman at Delaney High School in Baltimore County died by suicide. Since suicide's second leading cause of death for Americans under 40, youth suicide is unfortunately not rare in Maryland. But I found myself tracking this death in particular because my brother and sister went to Delaney. I'm still connected to that community in Baltimore County. And I saw online interpretations of this death going in many different directions. Among Maryland psychiatrists on our internal communications, we talked a lot about how maybe this is a sign that kids especially can't access mental health care. And that might be the big problem. I saw a report on Fox 45 concluding that the pandemic school closures were likely to blame for this death. But most heartbreakingly, they quoted the young man's father. He was trying to make sense of the unthinkable. He said, to quote him, "I'm still trying to see what I missed," his father said. As a father, as his advocate, his protector, what did I screw up? His father asked. So as experts, we have very little to offer these parents by way of an explanation, because we do very little to investigate these deaths beyond determining the cause and manner at the medical examiner level. Suicides always generate important questions for loved ones, for scientists, for physicians who are working to prevent future deaths. And when we leave these questions unanswered, we miss potentially life-saving opportunities to better understand suicide. By investigating these deaths, interviewing families, close collateral contacts, reviewing medical prescription records, social media history, and interactions with the community, We'll be able to not only identify patterns and proximal risk factors for death, but uncover missed opportunities for interventions. We can better target our resources and protect those most acutely vulnerable during as yet unidentified key windows. Suicide rates have been rapidly climbing. In Maryland, the suicide rate's gone up 30% over the 21st century. It's gone up 18% just in the past 5 years. It's now the highest it's been since World War II. According to the CDC and peer-reviewed reports, suicides cost Maryland close to $1 billion a year in combined medical and work loss cost. And these numbers are likely an underestimate, especially in regards to self-poisoning suicides. Senator Eckhart referenced this, but far more than any other state, Maryland leaves over 70% of our overdose deaths uncharacterized, not counting them as suicides or accidents, despite evidence that about a third of these undetermined deaths are likely suicides. We just can't be sure without further investigation, so we just leave them out of our rates. We don't count them, and we don't track them epidemiologically to target interventions. We're disproportionately prone to undercount the suicides of people of color and women because they're more likely to overdose than white men who tend to use guns, which leave very little question of the intent behind the death. Since my team recently published findings demonstrating that the pandemic has led to a doubling of suicides, specifically among Black Marylanders, a better understanding of these deaths has become even more urgent. A fatality review would solve this problem by allowing in-depth investigations of the intent behind such deaths so we can prevent further loss. The review board has the authority to collect a wide range of personal information about those who have died by suicide, and in turn, a responsibility to securely protect that information. The unique data collection power of an SFRC enables it to match data from different government and otherwise private data sets and conduct in-depth case and systems reviews of agency reports and inquiries, facilitates collaborations among key stakeholders, brings together existing data prevention efforts, data sources, and it can help guide future prevention efforts, harnessing data into impactful prevention programs and practices. Amidst the increasing suicide rates, both nationally and statewide in Maryland, the importance of innovative statewide efforts to reduce suicide has become unparalleled. The implementation of a Maryland SFRC is an extremely cost-effective venture for reducing suicide rates. By establishing a Maryland FRSC, we can ensure that the future suicide prevention-based state policies and programs will be informed by the most complete and reliable suicide data, which will ultimately lead to a more sustainable and impactful suicide prevention effort. Thank you.
Thank you very much. Are there any questions? Okay, thank you. We are going next to Dr. Alan Berman, Johns Hopkins School of Medicine.
Thank you, Chair Kelly. I appreciate the opportunity to speak with all of you today. I'm a clinical psychologist. I've been a resident in the state of Maryland for some 54 years, and 50 of those years I have been a student of suicide as a researcher and as a clinician. I'm a past president of the American Association of Suicidology. I'm a past president of the International Association for Suicide Prevention, and I'm a past director of the National Center for the Study and Prevention of Suicide at the Washington School of Psychiatry. I desperately understand how difficult it is to fathom suicide. After 50 some years of studying the subject, there's still so much we don't know. And this bill has an opportunity to teach us an awful lot that will inform prevention. We now know about suicide basically from the CDC and from a system called the National Violent Death Reporting System. So we know that in the state of Maryland, 17% of suicides are by veterans, but we know nothing about their deployment history, their combat history, what kinds of problems were going on in their family that may explain why they took their life when they did. We know that about a third of women die from overdose deaths, but we don't know if those overdoses were by licit or illicit drugs, by over-the-counter drugs, whether if they were prescribed, the decedent was adherent to taking them or not. We know that a certain proportion of suicides are by jumps, but we don't know if there are suicide magnets in the state relative to the frequency of jumps from particular buildings or from bridges. We know that about a quarter of all people who die by suicide in the state have communicated their thoughts about suicide to others, but we don't know to whom. We don't know what responses were given. We don't know what opportunities to intervene didn't occur. We need more data, and good data is at the heart of prevention. This bill would allow us to seek out and speak to knowledgeable informants, to integrate social service records, to integrate medical and mental health caregiver data. By virtue of that, we would then be able to know much better what proportion of these suicides are by people with different sexual orientations. What were the barriers to care in terms of accessing or affording or having knowledge of available services? What was the influence of social media in their suicides? What warning signs could we have known if only we had been able to understand these deaths better that would apply obviously to the next potential suicide? Let me give you 2 examples of why this data would be so important. In the state of Utah, this sort of data informed them some years ago that almost 2/3 of every young person who died by suicide in the state had been seen in the juvenile court system prior to their suicide. And as a consequence of that, they were able to integrate mental health services into the juvenile justice system. We did a study some years ago on suicides by railroad, on American railroads, on the rights of way in the United States. The railroad industry, on most of the rail carriers, wanted to put up signage urging potential suicides to call a hotline. We found in that study that only 2 of 55 deaths on American railroad rights of way, only 2 of these individuals carried cell phones with them at the time of death. Signage without a dedicated phone line would make no sense. Data informs prevention. This bill would allow us to learn so much more and potentially save so many lives. I urge you to consider this favorably. Thank you.
Thank you. Are there any questions? Thank you very much. And final oral witness is Michael Eagle. And you have 2.5 minutes.
Thank you, Madam Chairman. I'm Mike Eagle. I'm a retired Staff Sergeant from the United States Army and retired Baltimore County firefighter. Also, I just happen to be the IT director and the custodian records of the medical examiner's office. But I'm not here as a medical examiner. I'm not here in that behalf. I'm here on behalf of a staff sergeant, a captain, and a young, very young musician that all took their lives this year from suicide. Me, serving the public, have never been ingrained in this much suicide in 1 year. It's amazing I'm in a position to see this, and I'm amazed I'm in a position to help. I ask myself every single time, what can I do as I serve my public and my community? This is one thing I can do. I'm currently serving in the suicide prevention meetings with the Department of Health, and we do a very good job looking at those issues. This Senate bill would help me help others, and that's my job. Like I said, for over 50 years, I've done this. And people say, oh, 50, you're 59. I've been serving my public since I was 17 and continue to do so. So I urge you to allow me to help others as I've done for many parts of my life. I urge everybody here, help me, help them. Thank you, Madam Chairman.
Thank you very much. Are there any questions? All right, then that ends the testimony on that good bill, and we're going next to Senator McCray, Public Health, Behavioral Health Programs and Healthcare Facilities Safety and Community Relations Plans. You're on, Senator.
Yes, ma'am. Thank you, Madam Chair, and thank you, Mr. Vice Chair. Thank you all to the members of the committee for giving me this opportunity to speak on Senate Bill 96. Just for the record, my name is Corey McCray, Senator for the 45th Legislative District, and I come to you on a bill that you previously heard last year. This bill was passed out of committee. It also passed out of the Senate chamber, but I come to you on behalf of Senate Bill 96 last year because I've been able to work with our behavioral health organizations to come to some form of medium to create a higher level of transparency in reference to our interactions with our communities. When they receive their accreditations, one of the things that has to be done is that they have to put forward a community safety plan. And all we're asking for is that when they go to get their licensure from MDH, Maryland Department of Health, that they also attach that safety plan that's done with their accreditation organization, which is not a state organization. So the state does not have any knowledge of what they're putting forward in reference to how or what interactions they say that they're going to do to interact with the community itself. This bill is a lot more supported, Madam Chair, than it was last year. Been able to work with the behavioral health organizations. I actually did extensive two conversations with our Maryland Healthcare Commission, who came in with a letter of information, but as you see, that does not happen this time. And I did that with the vice chair over in HGO because of the testimony that they put forward last year. I do have one amendment, Madam Chair, because I want to make sure that I work out all folks' any concerns. It's a very small amendment, but this deals with our nursing facilities. For our facilities for our seniors, it also says, and this is Amendment 583-421, but it just says that it can including an emergency plan. This gives the opportunity for our seniors, the folks that are dealing with our seniors, our nursing homes, to be able to provide an emergency plan as a substitute for a safety plan. The reason why this is important is because, as our Attorney General will note, with ADA compliances, you cannot treat our behavioral health organizations different. You have to treat them as any other institution, and that's why our nursing homes was put forward too. But this also addresses their issue at that moment with amendment number 583-421 that the committee has at that moment. So I just say thank you again for working with me. I know that last year I had 3 bills on this issue. I come back before a bill that you've already passed before. And I just thank you for helping my community push this in the right direction. And as we have these conversations, I'm telling you that it is improving in the neighborhood that I represent. And I see that happens because of this committee right here, the Finance Committee. Thank you, Madam Chair.
Thank you. We have lots of written testimony, but no additional oral testimony. Thank you.
Yes, ma'am.
Okay, we're going next to Senate Bill 219. All right, this is a bill by the department. And so we're going to hear next from Antonio Salazar, Commissioner for the Maryland Department of Labor.
Good afternoon, Chair Kelly. Can you hear me?
Yes.
Very good. All the technology's working. Thank you. Again, good afternoon, Vice Chair Feldman, distinguished committee members. For the record, I'm Tony Salazar, Commissioner of Financial Regulation, and I want to thank the chair for introducing Senate Bill 219, which I'm here to present and request a favorable committee report. Senate Bill 219 is virtually in the same form as Senate Bill 754, which Senator Rosapep sponsored and which this committee and the full Senate, with stakeholder concurrence, passed last year. That bill failed to pass the House in the truncated COVID-19 session. So we're bringing up this important issue again because the law on money transmission needs to be updated. Senate Bill 219 takes a big step in modernizing Maryland's dated money transmission laws, and it better aligns them with the advancements in the financial technology that have recently taken place. Real quickly, the bill has a number of features. It updates definitions in the Maryland money transmission law so that they're harmonized with the state and the federal laws. It lowers certain fees for branches by creating a fee differential between brick and mortar branches and automated branches or kiosks. It eliminates a penalty of a mandatory license cancellation in the case of noncompliance with a change in location, giving the commissioner the ability to assess regular penalties if it needs to. It increases certain remittance of fund times. It prescribes the industry-wide use of the electronic NMLS system for reporting so that Maryland's reporting requirement is harmonized with that of other states. And it generally makes it easier for our office to carry out its regulatory obligations with regard to money transmission. money transmitters. So many of the substantive provisions of Maryland's money transmission law were enacted decades ago. They're very old, and the industry has experienced significant transformation driven by technical advances, including the advent of virtual currencies. So the laws need to be modernized to keep up with ongoing advances, and we see them serving as an interim step till the state system comes up with a modern model law on the subject, and that's expected soon. Fiscally, we anticipate that beginning in fiscal year 23, revenues from money transmitter licenses will decrease some, approximately $68,000, due to the fact that we're changing the licensing fees from $1,500 or to $1,500 from the flat $2,000 that is currently charged, regardless of the branch type or size. So we currently license 220 money transmitters, and of those, 35 are ancillary branches and 22 are automated kiosks, and those are the numbers that we use to calculate the readjustments. Of course, by reducing the fees, we may find that companies may increase their use of ancillary branches and kiosks, which would lessen that negative effect. But in any case, we request the committee provide a favorable report to the bill as it did last year. I'm happy to answer any questions or provide whatever information the committee may request. Thank you.
Thank you. Are there any questions? All right, well, hearing none, that ends the report.
Thank you, Chair.
Thank you. Going next to Senate Bill 235. And this bill also is here on behalf of the department. Who's testifying for this one? Okay, so Michael Leahy, Secretary of the Department of Technology.
Good afternoon, Madam Chair, Mr. Vice Chair, and members of the committee. My name is Michael Leahy. I am the Secretary of the Department of Information Technology, and I want to thank you for this opportunity to provide testimony on Senate Bill 235. This legislation would amend the annotated code so that monies paid into the Major Information Technology Development Fund associated with the sale, lease, or exchange of communication sites or facilities or communication frequencies for information technology purposes, or other agreements using information technology that involve resource sharing would be used to support the state telecommunications and computer network. So the language would change to say shall rather than may to clarify the intent. And this would provide benefits for the funding for not only the Maryland First Public Safety Interoperable Radio System, but also for Network Maryland. And in the past, funds had not been sequestered for those two organizations under the MITDP fund that came in under resource sharing agreements. So we are asking that this bill clarify that language. As you know, Madam Chair, the MITDP fund is crucial for continuing our upgrading of information technology and communication systems throughout the state. And Network Maryland is the information technology backbone for most of the state. And the MITDP funding is integral to its upkeep. Also, the Maryland First Radio System is designated and designed to provide radio communication across the entire state. And when it's completed, a public safety official in, say, Deep Creek Lake can talk to their counterpart in Ocean City. The system also provides air-to-ground channels for public safety flight operations. And in FY 2021, the Department of Information Technology is estimated to have 53 MITDPs across 25 agencies. And without this dedicated funding, these projects and the agencies they're intended to help would suffer. So for these reasons, I respectfully request a favorable report on Senate Bill 235, and I am happy to answer any questions. Thank you so much.
Thank you. I see that Senator Hayes has a question, if you will unmute yourself.
Yes, ma'am. Thank you, Madam Chair, and thank you, Mr. Secretary, for your testimony today. The MITDPF was something that was not something that I was very familiar with. So thank you for telling us about that. Who controls the expenditures from the fund? Is that solely the secretary? Is there a board or something? How are the
The secretary has final authority for the sign off, but within DoIT, we have what we call an EPMO, which is the Enterprise Project Management Office. And they do our analytics and research on particular projects and provide recommendations from the agencies. And then the final approval for the budgeting of funds for the MIT is done by the Department of Budget and Management after I, as the DoIT secretary, have said that the projects are technically worthy of moving forward.
Got you. And so the EPMO is made up of DoIT employees?
Yes, it is. And presently, we also have some contractors who actually do reviews for the EPMO, simply because under the current hiring freeze, we have not added people as other folks have left DoIT.
Got you. And I would imagine you guys need some type of flexibility with this fund. I guess I'm curious, are the funds that are held in here subject to minority business requirements?
We certainly apply them depending on the particular project. Some are not, but a majority of them are. And the example I'll give you is if a major project is with a vendor, say for a particular software that they own the intellectual property to the software, developed it, and continue to solely maintain it, and they are the sole source, then we would not have those requirements. If it is subject and open to competition, we certainly would.
Right, but you're not required to. That's at the discretion of the department. It's not something that comes like under Article 17 procurement code where they're required to.
I am not certain. I actually look for minorities to participate in our work, so I never really looked at whether it was legally required, but I will certainly get you an answer on that. It is our goal to bring as much work as possible to minority firms and to in-state firms, obviously.
No, I appreciate it. Thank you, Madam Chair. If you could get that information to the committee, I greatly.
I certainly will, sir. Thank you so much.
Okay, thank you. Are there any other questions? Okay, if not, then we're going to Norm Farley of the department, and all of the rest of these witnesses have 2.5 minutes each.
Good afternoon, Madam Chairwoman. I'm just here to provide moral support to my boss, Secretary Leahy, and to assist if there are any questions that were.
And Madam Chair, Mr. Shine signed up in case I could not be here today because of other commitments. So we appreciate the committee's indulgence.
Okay, and so now we're down. Oh no, that's it. Okay.
That's it.
Yeah, I guess you answered to all of your questions. Thank you.
Thank you.
Okay. We're going next to Senate Bill 256. This is a departmental bill also. Let's see which department is it. Department of Commerce. Introducing the bill will be Ken Skizzeritz.
Good afternoon, Chair Kelly, Vice Chair Feldman, and committee members. Can you hear me?
Yes.
Great, thank you. I'm Ken Shesh, Executive Director of the Maryland State Arts Council, and I'm testifying in support of Senate Bill 256. You have our written testimony and letters of support. I'm joined today by Stephen Scarrett Davis, Deputy Director of the Maryland State Arts Council, as well as Camille Kashaka, Executive Director of Motor House, an arts-focused development in Station North Arts and Entertainment District. She's a former member of Station North's Arts and Entertainment Task Force. Senate Bill 256 provides some much needed updates and clarifications regarding our Arts and Entertainment District program, which is administered by the Maryland State Arts Council. The Arts and Entertainment District program was created through legislation in 2001 and helps develop, promote, and support the arts and communities around the state to help meet local economic development and revitalization goals. We've included with our testimony a list of the state's arts and entertainment districts, as well as a map you can see the geographic diversity these districts represent. That means promoting available tax incentives for artists within these districts, helping promote tourism by leveraging a community's unique identity, attracting new business, and generally increasing arts activity. Artistic work is currently defined in the statute in a number of ways. And this bill will make explicit that this definition includes not only books, plays, painting, and musical compositions or performances, but also photographs, digital media, storytelling, and design. It would also clarify that a work of art can be a collaboration rather than something produced by an individual. This bill also ties the definition of an arts and entertainment enterprise to the artistic work, rather than limiting it to entities dedicated to visual or performing arts, which is how the statute is currently written. Together, these definition revisions clarify what is considered art for the purposes of this program, making the program more inclusive and more reflective of the diverse forms of artistic expression Maryland's artists produce. We believe these changes will provide clarity to Maryland artists and arts and entertainment enterprises about this program, help the Department of Commerce and the Maryland State Arts Council staff communicate the benefits of the program, and ultimately help local governments use the arts and investment in the arts to support economic development. I'm now going to turn things over to my colleague, Stephen Scarrett Davis, to explain the background behind this bill. Thank you.
Thank you. And each of your colleagues has 2.5 minutes each.
Thank you and good afternoon, Chairman Kelly, Vice Chairman Feldman, and members of the Senate Finance Committee. For the record, my name is Stephen Scarrett Davis, and I am the Deputy Director at the Maryland State Arts Council. In my role at the Arts Council, I oversee the state's Arts and Entertainment District's designation program. And I want to highlight that this bill was developed over a 2-year period, during which time the MSAC staff worked with our constituents, with A&E district managers, and with the public to collect feedback about how we could better support our A&E districts. As part of the feedback, our constituents have requested the clarity in this bill, so our program can serve them better and help them meet their local goals. We believe that the proposed changes conform the statute to current terminology in the arts field, and the changes align with existing interpretations and practice in the program. We agree with the Comptroller's Office that any costs associated with these changes will be minimal, and we believe that those costs will be offset by increased arts activity in our 29 A&E districts across the state. I'm sure I don't need to tell you, but the arts community has been hit especially hard by the COVID-19 pandemic. We believe that this relatively small adjustment to the A&E district statute will go a long way toward helping the arts thrive again in Maryland. And we respectfully request a favorable report on Senate Bill 256. I would like to turn it over to Executive Director of one of the anchor facilities in Baltimore City Station North A&E District, Camille Kashaka.
Thank you.
Hi, good afternoon.
Good afternoon. We hear you. We could hear you before.
It looked like her video froze, Madam Chair.
Okay. No, I can see her. We'll give her a minute.
Members of the Senate.
Okay, we hear you. Go ahead, we can hear you. No, we did lose her. Well, we've gotten a pretty good definition of what you're doing. That's the thing about this virtual world. Okay, we were hearing you. We were hearing you. Do you want to continue?
Okay. Don't worry about that. Motor House is an arts hub in the Station North Arts District, and I proudly serve on the Station North Arts District Task Force with a number of community members who all work to preserve and celebrate the culture of our city. Motor House's biggest successes are always tied to the community in which we live and our connection to the artists, audiences, and businesses that coexist in our district. We're a collaborative community, from cooperating on festivals to problem solving to advocacy. And in the 11 months that I've been a member of the Station North Arts District, I've already seen the benefits designated an arts and entertainment district in Maryland. Our building houses half a dozen arts organizations, over 15 individual artists, and innumerable production companies who utilize our first floor facilities. All of them should be able to benefit from the work that they do in our arts district. We have designers, photographers, and digital artists in the space that, with this clarification, will be able to take advantage of the tax benefits of working in Station North. A happy side effect of being an arts hub is that our residents collaborate organically. The expanded definition of this program will incentivize collaboration and multidisciplinary work. And in this way, these artists will be able to do this more often, deepening their impact in our community. The financial impact on our residents is invaluable. Artists are the architects of our culture, and we need to provide support and opportunities for them that allows them to do the work and live. The tax incentives of being in an arts and entertainment district help us to retain artists in our neighborhood. This provides us with valuable cultural activities that urge people to come to our neighborhood to participate in these activities, and inevitably sparks economic activity and numerous businesses and organizations in the neighborhood. Our cultural and economic ecosystems are inextricably linked, and retaining artists in arts is paramount to our success. Thank you.
Madam Chair, you're muted. Madam Chair, you're muted.
You're muted.
Okay, I look forward to coming to your art district. You guys have made it sound very interesting, and thanks for all of the testimony. We're going now to. Oh, Senator Hayes.
No worries, Madam Chair. I just wanted to thank the presenters today. It's long overdue that we kind of update this to allow for a lot of artistry. My district probably hosts about 85% of the culture and arts institutions, including the Bromo Arts District. And it's really provided an opportunity where, it's attracting people of all cultures and diversity to, some areas that really haven't seen that vibrancy in a long time. And so thank you all for taking on this challenge and bringing this to the community today.
Thank you. All right, we're going next to Senate Bill 83, Senator Kramer, Utility Regulation, Consideration of Climate and Labor. And once the sponsor has finished, the first speaker will have 5 minutes. That will be Rick Benetti, and other speakers will have 2.5 minutes each. Okay. All right, you're on.
For that. Thank you, Madam Chair. Committee, Ben Kramer here introducing Senate Bill 83. This is a bill that will be somewhat familiar to the committee, so I'm not going to take a lot of the committee's time. We passed this bill overwhelmingly last year. And we just ran out of time with the shortened session to get it across the finish line. But the simple aspect of this legislation is that in addition to those things that currently the power plant research program does in an evaluation of electric power plants, will now require them to continue to do research on climate change as part of their requirements. And clearly, and again, I'm not going to take a lot of the committee's time on this. I know every member of this committee understands that we are in the midst of a climate crisis, and every little bit that we can do to ensure that in state government, we are doing our best to minimize our carbon footprint and to fully understand what it is that we are doing so that we can, in fact, minimize that carbon footprint is very important. We've set high standards, high goals for reducing our carbon emissions and our greenhouse gases. This legislation just ties directly into what we're doing in all other areas across the state on this very subject. And so we need to understand, and the Public Service Commission and the Secretary of the Environment need to understand that these are the implications of electric power plants on climate change. And that's predominantly what the legislation it does, and real fast. Subject. Part of this is an evaluation of the greenhouse gas emissions and climate effects of different electric power generation technologies based on the best available scientific information. And two, whether the greenhouse gas emissions and climate effects of electric power generation technologies are consistent with the state's climate commitments for reducing statewide greenhouse gas emissions. And so that is the heart of what this legislation does. It also provides a provision that in supervising and regulating public service companies, the commission shall, in addition to what they're already doing now, also consider the maintenance of fair and stable labor standards for affected workers. And then it has a list of several items that utility companies are to report on so that they have a better understanding of what those labor practices are, as our utilities have moved very much away from operating with their own resources, their own people power in-house, to contracting those services out. And we really don't have a full understanding of how that is functioning at the moment, with so many of the utilities now contracting and subcontracting out their services. This will simply require that the utilities provide a report so that we have a better understanding of how that is working and if it's working best. So with that, I would certainly welcome again, I know this bill is familiar to the committee. We did pass it overwhelmingly last session. I hope that we can get it moving quickly this session so that we get it across the finish line. So thank you, Madam Chair.
Okay. Just so that I forewarn everybody, in about 5 minutes, the committee is going to have about a 10-minute break, and then we return to the rest of the hearing. So at this time, we're going to call Rick Benetti.
Okay, we're breaking in 5 minutes and then having.
Now you have 2.5 to, oh no, you have the 5 because you're.
Yeah, real quick.
Okay.
All right, thank you, Madam Chair. Hopefully I won't need all 5 minutes. Hello, my name is Rick Benetti. I'm here on behalf of Lioners Baltimore Washington District Council. We are in support of Senate Bill 83. Not to repeat what the senator said, but I just want to remind everybody this committee did hear a very similar form of this bill last year, and they passed it, and then it ultimately passed the Senate. The difference in this year's bill was simply add utility reporting requirements provided to the Maryland Public Service Commission about the trade classification, wage, and benefit information paid to the contracted out construction workforce that are used by contractors working on utility infrastructure projects. In 2019 and 2020, LIONA participated in the PSC's work group on alternative rates. Throughout that discussion of what Maryland's multi-year rate making would ultimately look like, it became pretty clear to us that the PSC did not think it should consider information about labor standards when it comes to rate cases regarding the utilities contracted out workforce. But we believe because the regulated utilities are such a large part of the state's economy and its contracted out workforce is so large, it's in Maryland's best interest that our regulated utilities use contractors that prioritize worker safeties and skilled training, pay family sustaining wages, and provide them access to meaningful health care. Other states have already taken these steps. Colorado, instead of using a procurement model that prioritizes price per kilowatt hour or price per therm above all actors, now uses what they call best value employment metrics. So the Colorado Public Utilities Commission now evaluates new resource acquisitions, or when they evaluate new resource acquisitions, they look at the availability of training programs, employment of Colorado workers, competitive wages and benefits offered to the contracted out workforce for those utilities. So the bottom line for us is, as Maryland moves into an era of multi-year rate making, the utilities are likely to experience a reduced regulatory lag and lower borrowing costs. And we think because of that, Maryland has the opportunity to be a leader and join other states that have adopted strong labor protections that promote quality job creation and workplace safety in their utility reform efforts. Along with this testimony, I've attached what our final comments were in that alternative rate making workforce. That was PSC case PC 51. There we argued, that Maryland should leverage new forms of rate making to fortify and expand opportunities for more construction workers to work their way into our state's middle class. So with that, we urge a favorable report on Senate Bill 83. Thank you.
Thank you. Are there any questions?
Madam Chair, I had my hand raised for the sponsor. I don't think my hand raised thing is showing up so that you can see it. Would I be allowed to ask either person, but maybe the sponsor, a question at this time?
Sure.
So I'm the newbie here. So just a question about, it seems like this is two bills. So why are we doing the construction, like the contracted out construction worker part? It seems like that's like a separate issue that doesn't have a lot to do with climate change. So I was just curious the rationale there.
Well, and the goal here, and I guess I failed to mention that in a case about, I don't know, a little over a year ago now, the Public Service Commission opined in the case that while there are things they would like to be able to consider, for instance, the climate crisis is part of what they were doing, that it was beyond the scope of what state law provides them. So we are now, with this legislation, granting them the authority now to take that into consideration in their work they do. But the two prongs to this are that one, we do need to ensure that the climate crisis is part of what the PSC gives consideration to in their decision-making process, but also because the utility companies now have gone to this model of contracting out so much of the work they do rather than doing it in-house, that it's important for the Public Service Commission to have an understanding of the implications of what that means and to be able to include that in what they are doing and what they're considering, because we do want to make sure that our utility infrastructure is in fact being done to the best degree possible, and that we are not shortchanging our utility infrastructure by virtue of the fact that there's a lot of contracting out now. And there will be another bill that we'll hear later this week, more that it ties in very specifically to these issues to ensure that this is not a race to the bottom to find the cheapest contractors, and that we are getting good quality work with contracted services. So it's it's dual purpose, but the goal is these are things we want the PSC to consider.
So the perspective of the bill really is more the PSC scope as much as it is climate change. You're wanting to include climate change into what they're considering. I guess concern I have, and I was looking at PEPCO's letter and some others on the opposing side, just trying to get familiar with the issue on both the positive and negative. One concern I have, and every time we start talking about evaluating factors that go beyond service and rates that the PSC should look at, and I admit I'm very new to this, is if we're going to restrict the ability of the PSC to perhaps let a PEPCO or a SMECO or whoever to add more capacity to electric generation or add more, I'll just say capacity, because it might affect climate change. We sometimes end up, I'm just concerned. We all deal with outages in our communities and all that kind of stuff. So I'm just trying to figure out that balance. I don't know if you could help me with that. Is this going to impinge upon the ability of a PEPCO or a BGE to add greater capacity, more towers, more connections, or not?
And the answer to that quite simply is no, not at all. This does not tie the hands of the Public Service Commission in any way, shape, or form. It simply says, PSC, you now have the authority to take into consideration, and the responsibility, quite frankly, to take this into consideration when you were contemplating these decisions. So again, the Public Service Commission publicly indicated that they did not believe under state law they have this authority, and not that they were saying we don't want the authority. We just, it's not part of our charge at the moment. This will give them that ability.
Thank you. Madam Chair, thank you.
Thank you.
Thank you. All right. Did we hear from Rick Benetti? Okay, Anthony Field.
Thank you very much, Madam Chair.
2.5 minutes.
Okay, thank you. My name is Anthony Field with Chesapeake Climate Action Network. I'm not going to repeat a lot of what Mr. Benetti and Senator Kramer already said, but to kind of expand upon what they said, essentially right now, the PSC does not have a specific mandate to consider climate change when it makes decisions. The Maryland Public Service Commission, as you all know, is a core part of the state government and the principal regulator of electricity in Maryland. If the state is to meet its climate goals, then this key agency must factor into its decision-making while keeping labor standards and equity front and center. The climate issue came squarely before the PSC 2 years ago. There were several environmental and community groups who appealed the PSC's decision to approve a former coal plant's repowering to gas, in part because the agency did not consider how climate change would impact the project itself. In response, the PSC commissioners essentially said that their hands were tied. They stated that the governing statute, quote, does not specifically or generally require considerations regarding climate change, unquote. Similarly, as Mr. Benetti mentioned, the PSC also stated that the commission is not mandated to make decisions about labor standards. Again, so the issue of this bill is to essentially grant the PSC, authority and ability to review these two specific issues. Senate Bill 83 would provide a necessary and common sense solution to the PSC's current limitations on considering climate change and labor impacts. It creates an effective and straightforward process to bring the PSC in line with the rest of the state's climate commitments and allows for labor standards and equity to receive fair consideration. I have submitted additional written comments, including a sign-on letter signed by 35 organizations and businesses. I would like to remind the committee that, again, this did pass through the Senate and, had, the COVID the session not ended, I believe we would have gotten over the finish line. So thank you again for your time. Thank you for your service to the state of Maryland. CCAN Action Fund urges a favorable report on Senate Bill 83.
Thank you. All right, and finally, we have Stacy Hartwell of the NAACP. You have 2.5 minutes. And if you see me disappear, I'm being called to do something that is an administrative requirement. And following Ms. Hartwell, we're taking the 10-minute break and we'll all reassemble for the last 2 bills.
Thank you. Madam Chairwoman, Vice Chairman, members of the committee, and colleagues, good afternoon. Again, for the record, my name is Stacy Hartwell. I am the co-chair for the NAACP Maryland State Conference Environmental and Climate Justice Committee. Our committee represents the environmental and climate equity interest of our members and BIPOC residents in the 24 counties across the state. The impact of climate change are evident all around Maryland. Ellicott City just recently experienced 2 1,000-year floods. Baltimore City suffers from one of the highest premature death rates related to air pollution in the country. Prince George's County received an F from the American Lung Association, and this summer we saw an increase in sunny day flooding in Annapolis and in our Bay communities from Cambridge to Solomon's Island. We have seen this firsthand, coupled with the devastating impacts of COVID-19, where Black and Latino populations are being crushed by COVID. One of the root causes of this is air pollution resulting from emissions from power plant smokestacks. I'm here today to urge this committee to issue a favorable report on Senate Bill 0083, Utility Regulation, Consideration of Climate and Labor. I'm sorry. Excuse me for 1 second, please. Sorry. I'm sorry. Again, to consider for climate and labor. The Public Service Commission has a responsibility to Marylanders to consider the devastating impacts of the climate crisis, as well as to ensure that workers are treated equitably when making decisions regulating our energy use. The NAACP Maryland State Conference has worked shoulder to shoulder with many of you on this committee to pass landmark legislation such as the Clean Energy Jobs Act, Greenhouse Gas Reduction Act, offshore wind, and many other initiatives to address the climate crisis. Yet we also need the Public Service Commission to factor in climate change into their decision-making. To not factor in climate is to ignore the fact that 40% of the state's emissions come from electricity generation, plus associated deathly health consequences in BIPOC communities. If Maryland wants to achieve its ambitious clean energy goals, then its state agencies regulating our power and gas supply need to make climate a core consideration in their decision-making. The PSC must consider climate in its decision-making to help Maryland meet our ambitious climate goals and to protect the well-being and health of our communities. We look forward to your support of this important legislation. Thank you for your time and consideration.
Thank you, Ms. Hartwell. The committee is going to take a 10-minute break at this time. Please do not leave the meeting. I'm going to put everybody on mute and we'll be back in about 10 minutes.
Hey, colleagues, I stepped out for a minute to go to BNT. What was the last bill we were on before the break?
83.
Okay, thank you.
And Tammy, if I can share with you where Senator Hayes just came from, they have called me and said, I am needed immediately for the bill I have in that committee.
Okay, Senator Kramer, thank you. We have
All right.
finished with Senate Bill 83.
Was that it, or you said we are or are not?
We are finished.
Okay, perfect. All right, good. Thank you.
Do we have to stay around for questions, Tammy?
Excuse me?
Do we have to stay around for questions?
There were no, we didn't see any raised hands at the end of the testimony, so we didn't think we had any questions.
Oh, okay. All right. I thought we were staying around for questions, so sorry. And I sent you a note also about, do you see a note in the chat?
I don't right now. I've got 10 things on my screen.
I bet you do. Okay. You can take a look at it and I'll put my email address there and perhaps we can just take it offline.
Okay, thank you.
So Tammy, are you there?
I think she's working on something, Kramer.
All right, are you there?
Yes, sir. We still on hold.
We're still on hold. All right, I'm back from B&T.
Yes.
Thank you.
Thank you for announcing.
If everyone would please stay muted. We are live streaming. Please stay muted.
We're live. Okay. The Senate Finance Committee is back in session, and we have okay. Senate Finance Committee is back in session, and at this time, we're going to hear from Senator Hedelman with Senate Bill 279. Senator, you have the time that you need, and your first witness will get 5 minutes. Others will get 2.5 minutes each. So why don't we hear from our sponsor now?
Thank you so much, Madam Chair, and thank you very much, Mr. Vice Chair and members of the committee. I'm Shelley Hedelman from District 11 in Baltimore County, and I'm here today in support of a bill that you actually have heard before. Senator Feldman was the main sponsor of this piece of legislation for many years, and I thank him for his support then and now. Senate Bill 279 would create a pilot program of overdose prevention sites. It would create a pilot program of 6 sites in different parts of the state, 2 urban, 2 rural, and 2 suburban. I, like many of you, know far too many people who have lost loved ones to an overdose. We use the word crisis these days to explain what's happening in our communities. And while overdose deaths were already increasing nationwide in the months preceding the COVID-19 pandemic, the CDC recently reported the highest number of overdose deaths ever recorded in a 12-month period. And in Maryland, drug and alcohol-related deaths have increased over 12% across the state just from January to September, compared to the same months the prior year. At least 1,800 fatalities were linked to opioids, and that's a 14.5% jump from the same time a year earlier. We know that fentanyl, the synthetic opioid that is 50 to 100 times more potent than heroin, has factored into over 90% of those opioid-related deaths. Last year, our budget directed over $700 million to this crisis. And we have spent many, many years convening task forces, work groups, et cetera, who have come up with important initiatives, but we need to do more. This year, those who battle substance abuse are also faced with social isolation, disruptions of support, impeded access to care, and economic distress. And these all contribute to the continued climb in overdose deaths. What we have done and what we're doing is not enough. We need to use all available tools, ones that are evidence-based and have been known to work, employing a multifaceted, multi-pronged approach that will save lives. This committee and the General Assembly are doing important work, as I said. We've broadened educational programs. We have reined in prescription opioids. We have expanded naloxone access and medication-assisted treatment, and all those are all important initiatives, but we can do more and we should do more. This bill, let me say from the outset, is not a mandate. It is not a directive. It doesn't make any community do anything that they don't want to do. What it does do is it enables local communities to decide what's best for them. Under this bill, if a community organization, a hospital or a local health department, a federally qualified healthcare center or substance use treatment center wanted to offer an overdose prevention site, they would work with their local health department, apply for approval to the Department of Health, and get permission to operate. Substance users would be able to come to those sites with their pre-obtained substances and used under the careful supervision of healthcare professionals. And a variety of services would be offered at these sites: wound care, substance use disorder education, reproductive care, HIV testing, et cetera. It could be a really important avenue for getting people into other kinds of healthcare treatment. There are 12 countries that host over 150 different overdose prevention sites around the world. And there's a 17-year history of one of those sites. It's called Insight in Vancouver, British Columbia, and there have been 0 overdose deaths in that site. And crime in the immediate neighborhood around the site has been reduced at a substantially higher rate than other parts of the city. They've overseen over 3.6 million injections without a death, and overdoses in the surrounding neighborhoods have also declined. And there are similar programs in other parts of the world that have experienced similar results. What saves lives should be guiding and driving our policy decisions. What is evidence-based and has worked and proven to be effective in decreasing substance use and in saving lives should be driving our policy decisions. We must consider, in light of the devastating and added impacts of the pandemic, a new but data-driven approach. And I ask that you keep your mind open and that you listen carefully to the professionals and the experts in the field of substance use and harm reduction that you will hear from shortly. Overdose preventions are certainly not a panacea, and I'm not arguing that they are, but that they are a very important tool that will help us to address this crisis that continues to take so many lives. Immunizations, and I understand the governor just had a press conference that talked about an expansion of access to vaccines, will provide relief against COVID. OPS will help to provide relief against substance abuse. So respectfully, I ask for your support of Senate Bill 279, and I thank you very much for your attention.
Thank you. Are there any questions? Okay,
Yes, ma'am, Madam Chair.
move to the, yes.
Madam Chair, I just had a question of Senator Hedelman. I was reading the bill and I see the criteria, and this bill has come a long way since it first was introduced. So good job on working with all of the proponents and the opposition for it. But the areas in which it described, 2 urban areas, suburban areas, 2 rural areas, often urban is code for Baltimore City. And so my question is there other urban areas, like is urban defined, and is the thought is for the 2 urban areas to be in Baltimore, or are there other areas that would kind of meet that definition? Is the idea for them to co-locate in one area or be spread out?
So it's a very good question, and that's something that I'd be happy to talk to you about. We don't define it in terms of population, and I'll have to look in the code to see if there is a definition of urban. But there's certainly other, Frederick is actually one of the largest communities in concentrations of population in this state. And I know that there are others too, not just Baltimore City. Baltimore City, of course, would be, in my mind, one of them, since it is the largest city in the state. But whether the second one would be there, that's a really good question and something I'd be happy to talk to you about.
Excellent. Look forward to it. Thank you so very much, Madam Chair.
Madam Chair, could I ask a question as well?
Yes.
Thank you. Good to see you, Senator Hedelman. We were sitting next to each other last session, so now nobody's sitting next to anybody this session, but it's good to see you.
Nice.
Question for you about this bill as I look through it. I'm familiar with this idea, but I've obviously never really looked at the bill as closely, not being on the committee. Number one, I don't see anywhere in the bill where there is a governing authority beyond the local health department appealing to, I guess, a state health department.
Correct.
Would the local county council, city council, mayor, would they have any role in whether they would want one of these in their community or not?
Well, we actually have the mayor who is going to testify, and this is something that the city council has actually moved ahead on, but I don't think there's nothing in the bill that says that it has to kind of have the stamp of approval from the local jurisdiction.
Yeah, sure. And then my second question is, you referred to the governor's press conference and COVID and some of those issues. I know this bill has been around a while, but is this the right time? And a reason I ask that question is we are really struggling to get what we need taken care of. Health departments are really on the ropes right now with trying to make sure that they can get the vaccines out, get tests done, all the things we know about. Is it wise for us to be considering this right now?
So I thank you for that question. It's a really important question. I think that there's no question that it is the right time, because I think that so many people are really struggling in isolation right now with substance use disorder. And so, they're struggling to get the help that they need. It's really difficult to do this kind of work on telehealth. It is really beneficial to be able to go to a place where other people are experiencing what you're experiencing and to get help from professionals. So I think that this is just another way of addressing and the real issues that people are struggling with at this moment in COVID. So, as I cited in my testimony, the numbers are going up. So I just read something recently about how people are still getting access and are still using. Unfortunately, the treatment avenues, I think, are more limited. And this, in my mind, broadens and differentiates the kinds of assistance and resources that are available. So I think that it is totally appropriate within the health department services to have them expand in this way to address this really problematic issue.
And my final question, thank you. My final question, I'm obviously not sure that I agree with you, but I don't think I agree with you, but I don't want to go back into a back and forth. And I think there's a discussion we have to have, obviously, about priorities and where what we're doing. But you talked about there being like these things could be centers for all kinds of different services. So, like could a clinic that provides all sorts of services this would be something else they provide? Is that what you're thinking, like a Planned Parenthood that also is a safe injection site or something like that?
Actually, I would say, and I can envision like on the first floor is an OPS, and on the second floor is a treatment center or some other sort of community-based healthcare center, so that you have that connection and you have that association and you have those kinds of resources really nearby.
Thank you for your answers. Thank you, Madam Chair.
Thank you. All right, we're next going to Ron Phillips, and
Madam Chair, I have a question.
Available. All right,
Madam Chair.
All right, I'll get right to you. I was going to alert people because I see the mayor has shown back up since we had the break. The mayor will be following Mr. Phillips, and then Jesse Dunleavy will follow. Okay, now your question.
Thank you, Madam Chair. I really appreciate that. We have been tracking this, obviously, and I know that I'm not sure if it's the sponsor or if some of the other folks can share with us what's happened in Philadelphia with regard to the legality of this.
So there was an effort in Philadelphia, a big community group, to go ahead and open a site. And they tried to do that, and the federal government, under the prior administration, the Justice Department, took them to court and stopped that progress. There was a very important court decision, and I actually urge you to read the decision from the judge in Philadelphia that said that they tried to stop it under the crack house statute. And the judge's decision, it was very firm that actually the purpose of the program was the opposite. The purpose of the program was to help people who struggle with substance use, not to enable them to use more. So that court stopped. They appealed that, and then just recently a higher level court said that they had to stop. So I don't know if the community, I have not heard, and somebody on one of the other panels may know whether Philadelphia is going to appeal that again to continue their efforts.
Okay, thank you. All right, we'll go now to Ron Phillips.
Good afternoon, Madam Chair. I'm Ronald Phillips, and of course, I'm standing in for Vicki Morse, who had a medical emergency.
Yes.
I'm representing Bridges Coalition for Overdose Prevention Sites, and also representing Be More Power. I have personal experience with opioids. I've almost OD'd a few times, and I'm quite sure if I had an overdose prevention site to attend, I would never had those experiences. But now, as a harm reduction outreach worker, Madam Chair, I provide safer drug use supplies like syringes, naloxone to our community. And we're there for people when they're using, before they get overdose. We're there with hygienic supplies, like I said, syringes, but we're not there in that moment when they need us the most. In organizing with Bridges, I've had conversations with thousands of people through dozens of events, and we know there is a groundswell of community support for overdose prevention sites, Madam Chair, and especially in Baltimore City. We are educating and organizing with community associating leaders, lawyers, nurses, people who will use these sites, and many groups. All are in support of OPS. Relationships built by these sites will change lives. It would save lives. People trust our coalition, and they are relying on us to be their shelter, their reason for not being isolated. People are further isolated without overdose prevention sites. It just leads to more deaths. I'm here in honor of William Miller Sr., who testified 3 years in a row, as far as I know, and we lost him to an overdose. We lost him to an overdose that I know that he would be here with us right now if you would have passed this bill years ago. He would still be here with us. Maryland needs overdose prevention sites, indoor spaces where they can consume their own drugs in the presence of professionals, trained professionals, that is, with immediate access to life-saving interventions, medical care, emotional support, and non-judgmental therapeutic relationships. Again, I just want to reiterate that isolation it will be defeated by the emergence of overdose prevention sites. Please vote favorable for this.
Thank you.
Thank you for letting me testify, and I'm here for any questions if needed.
All right, are there any questions? Okay, we're going next to the mayor of Baltimore City, Brandon Scott.
Thank you. Good afternoon. Thank you, Madam Chair. Thank you, Mr. Vice Chair, and thank you to the members of the committee. I am Mayor Brandon Scott. I am joining you from the great city of Baltimore in full support of SB 279. I want to first thank Senator Hellman for sponsoring this bill and continue to be a champion for a new way of moving forward with substance issues in our state. I want to thank the advocates and service providers from the Bridges Coalition who do the important on the groundwork and who have been integral in building literacy and relationships around this issue. I also want to thank the many families that have been impacted by overdose here in the city and across the state. Those who are following this legislation and those who are not. Despite the pain that you have experienced, you have consistently shown up as advocates for a harm reduction approach to overdose prevention. Your bravery and courage in the face of great stigma and misunderstanding is powerful. We should all be moved to listen and learn from your experience. What strikes me, Madam Chair, members of the committee, personally strikes me about cities across the globe where overdose prevention sites is the lack of overdose deaths. Every year in Baltimore, we lose hundreds, if not thousands of people to fatal overdoses. We consistently, most of the time that I'm before members of the General Assembly, I'm talking about the loss of life to gun violence in Baltimore, which is far too much and something that we will deal with deeply and directly. But imagine that we lose more to overdose, and it goes unspoken about by many. In the first half of 2020 alone, we lost 427 people to opioid overdose deaths in our city. Think about the gravity of that, the amount of pain and trauma that each one of these people leaves behind for their families and their community. We have to accept that the way that we dealt with people who use drugs and the way we've attempted to address the issue are not only wrong, but have not worked to save lives. I grew up in Park Heights in Baltimore City, where we were taught to look down on people who use drugs to a point where we didn't even see them as human. It wasn't until I was older and away at college at St. Mary's that I understood that the realities of substance use and that it was fundamentally an issue of public health and well-being, not simply a criminal justice issue. I had to grow and mature in my own thinking and unlearn what I was culturally taught to know that these were people and that we owe it to them to try to keep them alive. I know many people can share in that experience. On a cultural level, a political level, we have to transform our understanding and be open to new ways of meeting people where they are, dehumanizing people and investing in punitive measures in response to this great challenge does not help our community stay healthy, nor does it keep our family members, neighbors, co-workers alive. This is a conversation that we started in Baltimore last January after I put 2 resolutions into the city council. from that conversation, it became crystal clear that we have a lot of work to do inside and outside of government to better support people through this issue. We are going to continue to do this work, working side by side with our community-based providers and advocates so we can invest in proven solutions and take action to save lives. We all have our work cut out for us. It is imperative that we as public servants consider harm reduction approaches and understand why we can no longer criminalize people or look down upon people. On behalf of Baltimore, we welcome this discussion around how we can expand our use of harm reduction interventions and the number of safe and legal evidence-based tools at our disposal to do our most important duty, and that's to save lives. For those reasons, I urge a favorable report on SB 279. Thank you very much, and I will take any questions that you may have.
Are there any questions? Thank you very much, Mr. Mayor.
Thank you, Madam Chair.
All right, we're going to hear next from Jesse Dunleavy. He's here, but maybe he's not.
I'm here.
Okay.
Can you hear me?
Yes, we do hear you now.
Okay, thank you, Madam Chair. The host of this is just sorry video. Okay, sorry. Thank you very much, Madam Chair, and thank you, Senator Hedelman and the other members of the committee for giving this legislation your consideration. My name is Jesse Dunleavy. My son, Paul, died of a mixed drug overdose in 2017. I loved and admired my son, and I know his death was preventable. I have witnessed the neglected needs of those who suffer with a substance use disorder, and I'm trying to spare others my son's fate and mine. And I've come to know that overdose prevention services are based on a deep commitment to human rights and public health. They reduce overdose deaths and the spread of infectious disease. They minimize the compounded miseries of arrests and incarceration, and they minimize drug use. Other facts that we know is that the US has the highest number of overdose deaths in the world by far, and that Maryland has a high rate of HIV infections. People are suffering, yet there's reluctance to implement proven initiatives. And I ask myself why. Certainly I understand initial skepticism with regard to overdose prevention sites. On the surface, they seem counterintuitive, but the fact is they work and they're proven. So our job is to educate, to combat the stigma that thwarts progress. This is an uphill battle because it's really hard to divorce stigma from criminalization, but nonetheless, it's a battle we have to take on because we simply can't continue to disempower people who are at risk, to remove resources from them, to isolate them, to force the most vulnerable people into back alleys, exacerbating their mental and physical health. I understand community resistance to an overdose prevention site. I really do. But again, we have to turn to education because if we're comfortable with jails and prisons where dehumanization is practically the norm, but we're uncomfortable with evidence-based healthcare that has proven to reduce deaths and bolster the likelihood of recovery, we really have to examine our thinking. Back to my son very quickly. He had disabilities. He struggled in school. He was socially awkward. He didn't feel good about himself in a lot of ways. I'm sure when he initially used drugs, they eased his pain, but he was always sweet and gentle. And he was incarcerated at one point, and in jail, he was mistreated, he was hungry, he was exploited, he was sexually abused, and his being dehumanized set him back. It took years to get his footing. When he relapsed in 2017, without a safe haven or any medical oversight, he died, and he died alone. An overdose prevention site would have saved his life and allowed his continued trajectory toward wellness and allowing him a life You may ask why you would support this bill, but I have to ask why you would not. Thank you.
Very impressive testimony. Thank you. Senator Feldman has a question.
Yeah, just very quickly, maybe back to the sponsor just for a second. So Shelley, just two things. Number one, is with regard to Senator Reedy's point about priorities. Again, just to reiterate, it's clear in the bill, is it not, that this is permissive, this is enabling legislation. And if that the local folks don't believe this is a priority, they're not required by this bill to do anything. Just so we're clear, is that correct?
Absolutely, and very good point. Yep.
And secondly, you know, there was a really outstanding video documentary done by a former Baltimore City police officer. And I think it would be helpful, because we have some new folks on the committee, if you could get a link to that documentary about the Vancouver Insight program, which is really pretty impressive. I think that would be helpful, and maybe put a little context, or, you know, humanize to some extent kind of what we're talking about. If you could do that, submit it to the committee, I think that would be, again, of value. So, Madam Chair, I just want to make those 2 quick points.
Thank you. Are there other questions?
Senator Hayes.
All right, Senator Hayes.
Thank you, Madam Chair. And to the Vice Chair's point, I think, and especially in Baltimore City, there's a unique situation. I think Senator Reedy brought up a good point. And if it should be solely at the discretion of the local health department, or if the council, you know, provided. And I think once you have it in like councils and stuff like that, it kind of politicizes it and don't leave an opportunity for them to locate. But it also provides an opportunity for a public hearing. And so definitely want to try to work with the sponsor to get clear on what the intention of this is, so we could provide the opportunities to the public that so desperately need it, but also providing for a good vantage point. Often when it's done within the agency structure, it doesn't allow for the opportunity for the public to weigh in on it, or give any feedback on location.
Okay.
I'm
Are there
happy.
any other questions? Yes, Senator.
I'd just like to say, I certainly understand. And again, as the vice chair said, this is something that would have to come from the community. It has to come from the ground, the grassroots up. It does not impose from the top down. But if there is a way that we can build in some of that public process, I'm happy to talk to my colleague about that. Sure.
All right, thank you. Okay, that ends the, oh, yes, we didn't hear from Mr. Matthews, Earl Matthews.
Thank you, Madam Chair, and good afternoon, everyone. And thank you, everyone else who have gone before me and gave their testimony on this this important matter to us all, to Bill 279. Once again, my name is Earl Matthews. I'm a certified peer recovery specialist, and I'm here on behalf of MPAC, which is Maryland Peer Advisory Commission. Thank you for giving me the opportunity to come here and share my experience with you guys. As I sit here and listen to everyone, I am the person that everyone's talking about. I am that person who suffered with substance use disorder for over 3 decades in the streets of Baltimore City, you know, from the exact same area that our mayor, Brandon Scott, talked about, you know, from the Park Heights corridor, you know, so I understand what it's like to be that person in the abandoned building, or putting a strain on our judicial system, or our hospitals, on our families and everything. I said I'm a certified peer recovery specialist. What that means is that I have lived experience with substance use disorder, right? Mental health disorders. I also have a family. I also, like we lost Will Miller, you know, I lost my brother. I buried my brother last week, right, as an indirect result of the disease of addiction, right? You know, substance use disorder. So I have a vested interest in this. Being a certified peer recovery specialist means that I have met the requirements, and I have been credentialed in certain areas to become what we would call an expert, you know, on harm reduction, on substance use disorder, on things, you know, bridging the gap for people to bring them, you know, to save lives, actually. You know, what I do on a daily basis, right, is that I participate in working on a syringe service truck as well. I heard a few people talk about it, you know, and we test people for HIV, test people for hepatitis, we give out naloxone. We give out wound care kits, you know, and the reason we give out hats, we give out gloves, we give out things to people that are just like me, who are some of our families, our husbands, our wives, our mothers, you know, our sons. We bridge that gap for them in harm reduction, right? What we do is we try to keep people alive. You know, I think someone talked about the substance use disorder isolating people, right? When people use alone, when I give people these syringes, and I know sometimes some of them are going in the woods or going into abandoned buildings, you know, I wish that we had a overdose prevention site where they could go and, you know, safely inject or safely, you know, however they use the substance that they're using, because as the evidence-based practice has dictated, someone else talked about, no one dies in these places, right? And we are losing a lot of people as a result of overdose in this opioid crisis, you know? So, you know, I heard someone talking about, is this the appropriate time, right? I like to say, just like someone else said, if not now, then when? Yes, this is the appropriate time. People are dying at an alarming rate, you know, coupled with COVID-19, you know, so like I've taken what I like to call a curse and turned it into a blessing, because like today I get to show up every day and to guide people, like, you know, because I was probably written off and you know, and when I was actively participating with, you know, illegal substances. So like, we don't write anybody off today. We help people find the help that they need. You know, so please, we ask people to please consider this bill, right? It's very much needed. It's very well needed, you know, so a favorable vote would be appreciated. So I'd like to once again thank you guys for giving me the opportunity to come out and share. And once again, if not now, then when? Thank you.
Thank you. And that's the final, very energetic and speaker on this bill. Thank you very much. Okay.
Thank you.
Going to our last bill, Senator Hershey, you're going to be the man of the hour. It's Senate Bill 53, Clean Energy, attribute credits and procurement. Except for the sponsor, the first speaker following him is Neil Fitch, who will have 5 minutes. Other speakers will have 2.5 minutes each. So let's start, Mr. Sponsor, Senator Hershey.
Thank you, Madam Chair. Can you hear me okay?
Yes.
Thank you very much, Madam Chair. For the record, Senator Steve Hershey to present Senate Bill 53. As many of you are aware, we are in an era of uncertainties regarding the energy procurement market. FERC's ruling last year to direct PJM to expand its minimum price offer rule, or MOPR as many of us know it, is perceived to put pressure on the state's ability to control its renewable goals. This has led to conversations and discussions on whether states need to make changes to its procurement methods, such as an FRR, which we've talked about, or even scrapping their RPS altogether. Senate Bill 53 is being introduced as an alternative market-based solution to help Maryland meet or even exceed its clean energy goals faster and more cost-effectively than other options. This proposal involves our existing RPS program to meet more aggressive clean energy targets. A forward clean energy market relies on the trading of clean energy attributes, which are very similar to the renewable energy credits that are being traded to meet today's RPS. So what does this bill do? It sets a new clean energy standard that will get us to 100% clean energy by 2040. It allows companies and customers to voluntarily purchase more clean energy if they choose to. It creates a central auction process that would buy clean energy credits 3 years before they need to be delivered, to allow time for new clean generation sources to be built. All carbon-free clean electricity generators would compete to sell their clean energy attributes at the lowest possible cost. New clean energy resources can lock in a price for 7 years creating a stable revenue stream that will help them get financing to build their projects. This proposal will ensure that Maryland can meet its zero emission carbon-free goals. Rather than being a complete departure from our current approach to securing renewable energy, this proposal builds on a market clearing approach and positions Maryland to be a leader in the pursuit of a clean energy future. Again, as many of you know, in 2004, Maryland passed its RPS. We've seen many changes to the RPS, but still have the same framework. In 2017, we increased the goals from 25% in 2020. Then again, in 2019, we increased the goal either further to 50% by 2030. But even the so-called definition of renewables has changed, and we're seeing constant pressure to continue those changes, as evidenced in the bills that we've already seen earlier last week. The renewable sources that are not named wind or solar are under constant pressure to remain in the RPS. And that is one of the struggles that we are having, and one of the things that will make achieving our goals even more difficult and unfortunately much more expensive. So with that, Madam Chair, there are some experts that are with me to testify on how this program would work. But at the same time, I'm certainly willing to answer any questions and ask for the committee support on discussing this bill as we look forward and move forward on discussing Maryland's clean energy future. Thank you.
Thank you. Are there any questions of the sponsor? All right, we're going next to Neil Fitch, NRG.
Thank you, Madam Chair. Thank you, Senator Hershey. Could you just confirm that you can hear me okay?
Yes.
Very good. Well, good afternoon, and thank you all again for the opportunity to speak. My name is Neil Fitch. I am Senior Director of Regulatory Affairs for NRG Energy. NRG serves approximately 7 million customers across North America, including in Maryland. In my role, I provide regulatory and market design support for our various business interests across the East, including in Maryland and the broader PJM region. I'm here today to support SB 53, which represents a modernization to the state's existing model for procuring and retiring renewable energy credits, or RECs, to achieve and provide a pathway to exceed Maryland's clean energy goals. This market framework, as envisioned by SB 53, allows market participants, whether they be developers of renewable energy resources, sellers of electricity, customers, or policymakers, an opportunity to see demonstrable success of the clean energy market well in advance of delivery of clean kilowatt hours. This market design utilizes the most successful portions of existing electric capacity markets and captures the benefits on behalf of carbon-free electricity generators and consumers. Importantly, this framework is durable regardless of the administration in Washington, the balance of the Federal Energy Regulatory Commission, or the makeup of Congress. We certainly recognize that in the last 2 years, you've heard a lot about FERC's MOPR decision and the potential for vulnerability to Maryland's support for clean energy. Maryland and other states with robust clean energy targets have an opportunity to reinvigorate the markets for RECs and establish a pathway to long-term success, both to the benefit of clean energy resources and consumers. By utilizing the mechanisms in SB 53, convening a forward-looking competitive market, Maryland can put itself in a stronger position to avoid future clean energy resources being subjected to the MOPR. Maryland policymakers have heard since that 2019 MOPR decision that the only way to preserve the future of clean energy would be to exit the regional electricity market operated by PJM and create a state capacity market by establishing a so-called fixed resource requirement, or FRR. Taking such a drastic action would be a costly overreaction. A forward clean energy market like that presented in SB 53 presents a viable and preferable alternative to such an exit. I'd like to note, Maryland would not be alone in contemplating this market change. In New Jersey, an ongoing regulatory proceeding dealing with these very same issues is considering a variation of the forward clean energy market front and center. Further to the north, both the states and the regional power market that serve New England are looking at a forward clean energy market and variations thereof. So like in Maryland, many state policymakers, market operators, and low carbon and carbon-free electricity resources are seeking constructive ways to utilize long-standing competitive market principles to achieve the state and region's clean energy goals. SB 53 will help Maryland do just that. Thank you for your time. I urge your support, and I am available for your questions.
Thank you. Are there any questions? All right, we're going next to John Fiestra.
Good afternoon, Madam Chair, members of the committee. For the record, my name is John Fiastro, here to testify on behalf of NRG. I want to thank Senator Hershey for putting this bill in again for us, and I think it makes sense to kind of highlight a few points. First, you know, the Renewable Energy Portfolio Standard and the Clean Energy Attribute Credit System that's laid out, the forward clean energy market that's laid out in the bill, have a lot of similarities. So let's start first with the procurement and retirement of RECs. The General Assembly has set forth percentages by which electricity suppliers must meet and comply with on an annual basis. The program as set forth in the bill doesn't change that. Electricity suppliers will remain in a position to procure and retire RECs. Renewable energy generators will be in a position and remain in a position to generate and sell RECs, but it's a little bit different in the mechanism by which they do it. Today, those are one-off exchanges between electricity suppliers and renewable electricity generators. They are reported on years after the completion of that transaction. For instance, in the current compliance year, 2021, we are only now aware of the results of the most recent compliance year, 2019. Those results are published on an annual basis in the Public Service Commission's regular report on the transactions related to the marketplace. So what does the bill do? It takes those one-off transactions and actually aggregates all those buying and all those selling and puts them together in a marketplace for an auction 3 years out. 3 years out. The ability to put a market build a market around a forward basis like that allows policymakers and stakeholders, developers and consumers all in a position to see what the cost of compliance will be in a forward market. In order to clear market, renewable energy generators and clean energy generators and clean energy developers must bid beneath the ultimate clearing price. And so that forces renewable energy, clean energy generators to actually sharpen their pencils and come up with a price that guarantees them market clearance. There's a lot of conversation, and if you look at some of the testimony that's been circulated about what should the constituent technologies be, what shouldn't they be, this bill contemplates the inclusion of some technologies that aren't currently included in the RPS. But what should be noted here is that that policy decision is still in the hands of the General Assembly. And this bill presents an opportunity to consider other technologies, but really at the center of it is the forward clean energy market, the mechanism by which future RECs are procured and retired. So I'm here for any questions, and thank you, Madam Chair, for your time.
Thank you. Are there any questions? All right, we're going next to Brett Leninger.
Can you hear me?
Yes.
Okay, thank you.
And
thank
you have 2.5 minutes also.
Yes, ma'am. Thank you, Madam Chair, Mr. Vice Chair, members of the committee. Brett Leininger here on behalf of NRG. Just to highlight 4 points, that this bill would drive to 100% clean energy by 2042. It creates a mechanism whereby there is downward pressure on the purchase of clean energy through the auction. It creates transparency and predictability with a 3 to 7 year outlook. From a policymaker standpoint, meaning you all, the lawmakers, you have an ability to make decisions not in a vacuum based on the information that is available now. It's old. This would be able to help you understand what's going on and what the commitments are at least 3 years out and up to 7 years. Also, from the standpoint of generators of energy, purchasers of energy, and the financial backers of those who are creating new energy. The final thing that I'd like to say is it's not a new idea. This is patterned after what is done in the capacity market today, and it works. I'm also authorized on behalf of client Brookfield Renewable to support for the bill. They were there with you last week in front of the committee dealing with the RPS, as Senator Hershey announced. And the idea that this would drive towards clean energy instead of just a renewable portfolio standard. And finally, the small municipal electricity companies who were also here last week from the standpoint of putting the downward pressure on the cost within the RPS, which is what they're seeking for in relief this session. So with that, urge a favorable report, and I'm happy to answer any questions.
Thank you. Are there any questions? Okay, we're going next over, let's see. That's it, isn't it? Oh, yes. Okay, Alex Pavlak. You have 2.5 minutes.
Yes, good afternoon. My name is Alex Pavlak. I'm a PhD engineer from Severna Park and the chairman of the Future of Energy Initiative. I wanted to present or look at this from a big picture point of view. When engineers develop a new system, we focus, we take the products of science and we build things that have a purpose. Everything is driven by purpose, requirements. And in this case, the requirements of the bill that are presented as clean generation. I would argue from a big picture perspective, that's not good enough. We want clean systems. Wind is very effective at reducing emissions whenever the wind blows, but how does this work if you have no greenhouse gas emissions? The real question is, what do zero greenhouse gas emission systems look like? We can build a system out of 100% renewables. We can build a system out of 100% nuclear. What are the costs and the risks associated with this? I would stipulate that the General Assembly needs somebody they trust to tell them what their options are. A year ago, I had this conversation with Senator Feldman. And what the senator had suggested is that one of the things that Maryland could do is put together a committee or a commission that consisted of a bipartisan commission that consisted of people from the House, the Senate, and the administration. And this commission could quantify goals. The goal here, in my view, should be reliable electric power systems with no greenhouse gas emissions. You need to see a path to that goal. And it could quantify the goals, quantify the options, and the costs and the risks associated with each option. Market-based systems are looking for the best next step, the cheapest next step. And the cheapest next step is not necessarily the best next step, not necessarily the step that gets you to zero in a reasonable fashion. The question really is, what does zero look like? The fact that we are part of PJM, and PJM, we can't do anything we want. We need to acknowledge the constraints imposed by PJM as a factor. As far as the this bill itself goes, it has good parts. It has parts that I don't like. In my view, the goal is wrong. You should be looking at clean systems, not clean generation. Market-based development is short-sighted. We should be looking at the big picture. And it does not adequately consider risks. I thank you for the time to express my opinions here.
Thank you. And we're going next to Darrell Carrington.
He didn't show up. He didn't show up.
Oh, he didn't. All right. I think he is not here. Okay. Were there any questions of the last speaker? All right, that ends the testimony on this bill and ends our hearing for today. Thank you.